I would sit up at night and I was just like, I don't understand how all of this is being churned out. And I just didn't want to be alive anymore.
So were you thinking of harming yourself? Were you having suicidal thoughts?
Yes, this was very, very clear.
That was a stunning admission from Meghan Markle during her sit-down interview with Oprah, revealing the pressures, the gossip in the tabloids, and her lifestyle at the time. It was truly harming her mental health, so much so, as she admitted there, that she needed to tell her husband she was experiencing thoughts of suicide. Many who watched Markle admired her bravery over sharing a struggle so many would hide. But there were other very loud voices doubting that somebody wealthy, privileged, beautiful could be suffering in such a way. So how do these conversations impact others dealing with depression or similar thoughts of self-harm or suicide? Joining us this morning for perspective is Dr. Elizabeth Rice from the Southwest College of Naturopathic Medicine. Doctor, thank you so much for your time. I know that there is a lot to unpack here, and I want to really begin by addressing the point that many non-professionals have, that somebody of her status, somebody who by all appearances lives a perfect life, couldn't be struggling on the inside.
Absolutely. And we never knew it. Watching her and seeing those photos and seeing those videos of her, she carried herself well. She had the smile on her face. There is so much stigma and shame surrounding suicide. It's a very lonely place to be. So to have someone like Meghan Markle, the previous Duchess of Sussex, come forward and share that she was experiencing that is a very powerful story for people who are suffering to hear.
And lately we've had more conversations about this in the public eye. Michael Phelps, Demi Lovato, high-profile people who are successful achievers saying that they have thought of self-harm. They are dealing with depression. It's part of their lives. So why do you think that there still is so much confusion about the root cause of some of these issues, and why in general we're not more empathetic about it?
I think because of the stigma and because of the shame associated with mental illness, it's just not talked about. It's not discussed with our children. It's not talked about in schools. There's so many reasons why it's still shrouded in darkness and in shame. And so having these discussions and people coming forward and sharing their experience, particularly people that we idolize, people that we think have the perfect lives, it really helps to reduce the stigma. And it might just help that 17-year-old boy or that 20-year-old female come forward and say, hey, I'm not okay. And it's these people are giving permission to our young folks and even to all adults that it's okay to be not okay, and to ask for help and to be courageous. And so to have these influential people be that person, it's really incredible.
So on the flip side of that, as many post on social media and have conversations about dismissing what she said or assuming it's a fabrication of some sort, or a call for attention, what does that conversation do to the ears of somebody who might be hiding a very personal, painful struggle?
Yeah. The desire to want to die by suicide is very real, and no one can deny that situation. I think that many people try to, and they try to dismiss it because they just don't want to deal with it. They don't want to handle it. They don't want to have those hard discussions and those hard conversations. But it's a very, very real crisis that's happening within our global society right now, especially during the pandemic. We're up to 4 out of 10 adults are experiencing depression or anxiety. That's up from 1 out of 10 adults just in 2019.
Well, thank you so much for lending your professional perspective on this, and it is an important conversation to have, and we want to do our part to direct it in the most positive way we can. So we appreciate your time this morning. Thank you.
Thank you very much.
And for those of you at home, if you or someone you know is struggling with suicidal thoughts, there is always help out there. The number to the National Suicide Prevention Lifeline is on your screen right now, 1-800-273-8255 or 1-800-273-TALK.